Oh, it's beautiful.
Thank you. I was
You're
worried about the
welcome.
colors because I'm one of those. I have ADHD, so I have to have like color, or I will be bored staring at it.
Yeah, I hear you. So I am just kind of waiting for people to come now.
Uh, and in regards to the interpretation, whomever needs the interpretation, they have their own room. Do you know how that's gonna work?
Yeah, I don't know how that's going to work. Did you want me to send you to a breakout room?
Whichever works best for you, but I would assume that would be the best way to go because if I'm interpreting at the same time that Miss Jones is speaking, which I do in my interpretation, but I just don't want to talk over her.
Oh, okay. So only the people that's in the breakout room with you would hear you.
Yes, they
Okay.
will see you, but they will hear my interpretation.
Okay.
Okay. And that is something. Let's see if it will do it here. Okay. Let me see because I don't see the breakout sessions, the breakout rooms.
They might not have any available for the type
Yeah,
of
because
Zoom.
we didn't even train for that. We just trained to have interpretation interpreters have access and be on. There are no breakout rooms here. Hmm.
Is it possible that the Spanish speaker participants were sent a link to open that link so they hear me?
Oh,
That's the
right.
breakout
So
room.
they would have to be
It
a part of
is,
two separate Zooms.
yes, I, I, I really don't know how they structure it, but
Well,
I'm
that's how
here.
they would have to do it. Yeah, if they don't have breakout rooms, then they would have my link to see my presentation, and then they would have her link to hear her, so they could mute me and then listen to her.
Something else we can do is that I can interpret consecutively, but that means you speak 3 4 sentences at the time and then give me a moment to do the interpretation. Usually
I mean,
that
you can
doubles the
if they
time
give
that
us
way.
the time, but my presentation is an hour long, so that would probably make it like 2 hours long.
Yes. I'm here to assist you the best I can, so just let me know
Mhm.
what you would like me to do.
Okay. Yeah, they might end up having to get two separate Zoom links so that they can listen to her and
Hmm.
just mute my audio.
Yeah, I don't think that's honestly, I don't think that's possible.
Oh,
Not the way we did not set that up. See, because they have something down here that says interpretation,
mhm.
and they do not have an actual room or a way to have
Right, for an interpreter.
right,
Yeah, because I see it showing up on mine too. It says interpretation available.
right. Yeah, so it would have been great for breakout. So this is definitely something I'm going. Well, let me see if my administrator could possibly help with this.
Okay, thank you. I'm here
Well,
to do whatever you tell
it
me to
says
do.
you can mute the original audio and you can listen in Spanish, but I don't know how that actually works.
So let me
'Cause I've
see if
never used the interpretation.
And so I don't see anyone in the waiting room or anything, so.
Yeah, I just closed out the other Zoom. They're still over there talking, so people probably haven't left the main session yet.
Oh, okay.
Yeah, because they were going over the ambassadors and stuff like that.
Okay. All right. I just wanted to make sure that the links were available. Well,
Yeah,
this
and
gives
because I wasn't sure if I had to have it in PowerPoint, but I saw I could present directly from Canva, which works because I'm doing this from my work computer and my
Mhm.
files don't mix on my like from my personal computer to my work computer. So I was like, oh no, I hope this works.
Yeah.
Because the file's too big to email it to myself and then use it that way. So I was like, oh, I hope this works.
Right. Wonder if I could, I would see how we can do the interpretation. Yeah, is that usually how you do it? I'm sorry, um
Delfina.
Delfina, is that usually how it's done in the Zoom, that you have a breakout room and you're interpreting there?
Yes, in that way we can interpret simultaneously without doubling the time. I mean, like I said, I can interpret consecutively, but Miss Jones, that's gonna take, like you said, at least 2 hours, which is okay with me, you know. But I understand we have another session right after this one.
Oh, there are people. Okay, let's see.
Okay.
Let me let these people in. Wait a minute. Okay, what's going on? Come on, allow the time. Hello.
Hi,
Hi, welcome.
thank you.
We're just trying to figure out a couple of logistics. Anybody that joined, do you need interpretation?
No.
¿Hay
No.
alguien que se acaba de unir al grupo que necesita interpretación? No respondents.
Okay. So I'll go ahead and get started, and then as people shuffle into the room, then they can join. So my name is Octavia Jones, and I currently work for the Cleveland Department of Public Health as a health outreach specialist. My supervisor is the health commissioner of the Cleveland Health Department, and she specifically requested that the person who fills this position is a certified community health worker, and she's actually looking to get more positions filled. She worked very closely with CHWs during the pandemic time to get vaccinations, information, and all sorts of things accomplished with the public health department. And she loved that experience and wanted to be able to keep them on full time. But, you know, of course, many of our positions are grant funded and things like that. So as the COVID money ran out, she wasn't able to keep them on, but now she's able to make more permanent positions. And that's how I ended up here. So love my job, absolutely my dream job. I never thought that I would find it with a government position. So, and honestly, it's due to the leadership that I get to enjoy. She's very aware of what we are capable of, and she does respect our leadership and our voices. So it's a very um, honored and blessed position to be in, to be able to do what I do best and be supported by my leadership as well in doing it. So this presentation is to provide community health workers with the confidence and also just some basic structural support for providing communities with health education. So that's one of the biggest parts of what we do out in the community is keep people aware of what's going on as far as health concerns go, helping them understand what their doctors are telling them, helping keep them on their proper medical plan, and just be more comfortable with advocating for themselves because we may not be able to work with them continuously, or anything can happen. They move, things like that, and we want them to still feel empowered to be able to use their own voice to advocate for their own health. I found this quote and I thought it really fit us. So never believe that a few caring people can't change the world, for indeed that's all who ever have. And that's so true. So it's not a lot of us nationally, but we do have a massive impact on health outcomes all across the nation and the globe. So it's definitely a unique space and position to be in. And it's also wonderful that we're born and not made. I love that anthem. That was actually my first time hearing it yesterday. So I did already cover the purpose, and as I stated before, I actually found this kind of purpose through reading a CDC evaluation that they did of community health workers back in 2016, and they asked several different questions on the questionnaire. But one of the answers that stood out the most to me was that a lot of community health workers aren't comfortable with providing health education. Not that they can't or they don't, they're just not very confident in doing that. And being confident is very key and vital to securing that leadership and securing that respect for our leadership and our voices. So I absolutely want to be instrumental in getting us there. So these are the topics that we'll cover in this presentation. I'll go over some toolkits that are already available that you can just pull the documentation, print it, send it in PDF form. If you're doing a virtual presentation, you can just email the PDFs out to clients or to the group that you're presenting to. They're very accessible and easy to follow and use. How to create your own presentation. So if those presentations don't work for you, or if the information is a little bit too in-depth and you just need something that's a little bit more basic, you can always create your own at the level and with the type of information that you need for what you're doing. Health organization newsletters, those are great sources of information. Evidence-based resources. Typically, it's hard to figure out what's good information, what's bad information when we're swimming in information, up to our eyeballs in it. Technology training and courses that are available and that are useful. We're getting into a more and more technological world, and it's very pertinent that we as community health workers have access and know how to do this so that we can train our clients, and then also that we ourselves have access to more resources in that realm. And then also growing your network. We are a network-based work group, so we absolutely have to always expand as much as possible with the people that we know and the things that we know as well. So for the toolkits, the CDC has some really in-depth toolkits, and they provide a ton of research as well. So this kind of is a double duty website where you can find those toolkits and those evidence-based resources. I love using them, especially for health information, because they're typically on the forefront of the reporting for a lot of that, for a lot of those conditions and diseases. So definitely bookmark them, add them to your pages, all of that, because if you, especially if you work in public health like I do, you will use them a lot. The National Institute of Health, their National Heart, Lung, and Blood Institute actually provides a wonderful, beautiful set of food toolkits. So you can provide families with culturally appropriate recipes that can help them with managing their weight, their blood pressure, their diabetes. So a lot of the chronic diseases that we're trying to help clients combat can be directly impacted by the foods that they eat. And we know food is super important to culture. So when you tell people, oh, you can't eat, your favorite, dinner, family dinner or holiday dinner because it has all of the things that could, run your blood pressure up. That's going to be, a lot harder for them to stick to, other than, oh, well, you can eat that same meal, but just use these type of ingredients or cook it this way, and it'll be that much more heart healthy, but you can still maintain that same cultural interaction. And I'll actually, on the next slide, I'll show some examples of these as well. And then infographics. I love infographics. They are a great way to reduce the issue of literacy barriers because they are a ton of pictures. So infographics typically have way more pictures than they have words. And they provide a lot of information, typically on one sheet. So even just front and back, but usually just one sheet on the front holds a lot of information, and it's a great way to reach a wide range of audiences with a lot fewer trees killed. So, so definitely keep in mind infographics are an easy way to pull a lot of information, and then with that you can just do a quick Google search for the topic that you're looking for, and when you click on the images tab, so like let's say you're looking for heart health infographics, you also want to say infographics specifically in the search that you're doing, and it'll pull those to the top of the search for you. Then when you click on images, it'll have just infographics. And typically you'll see a lot of these organizations that I listed earlier. So CDC, NIH, sometimes the Heart Association would come up with their infographics. So you'll see their emblems first, because typically people use their information the most because it's evidence-based. And so here are the CDC toolkits I was mentioning. This is the exact website to the Road to Health toolkit, and that was just the landing page. And then this is where the resources actually are. So they have guides, they have session materials, podcasts, videos, participant worksheets, and then they do also provide some research information as well. So this was very comprehensive, honestly, and it's definitely worth a look. And so this is just a screen recording that I took of those resources. So the previous page had the drop downs, and this is what the drop down looks like when you open it. So you have posters that you can use to promote the information. This is a game that you can use to promote the learning of the eating habits. And then this is another poster, and then that's the video I was mentioning earlier, and then they have the podcast there. It's about 2 of them, and then the worksheets are available in PDF format and food logs, so you have things that you can go over and follow up with your clients on as well, so you can see their progress and help them stay on track. And then this is another screen recording of the landing page for that, for the other resources that are available through the CDC website. And so they actually have a full list of resources by topic. So as you can see here, and this is pretty much every disease that plagues our country now. And they have resources available under each category. And it tells you the type of resource. So you have either a web page that has information. Some of them are PDFs, or that one here is a report. And so they present the information that they've gathered, and then it'll also tell you if the information is available in other languages. And that one in particular is an educational material. They have fact sheets, love their fact sheets. Typically, if I make my own infographic or my own summary page, I use the CDC fact sheets for it, because they're very concise and they have a lot of accurate information on it as well. And see, this has a lot of resources, as you can see, and then it just follows by topic. And so the journal articles, those are your primary resources, and we'll talk a little bit more about that later in the presentation when I talk about how to vet resources and find evidence-based resources. And so this here, I just clicked on one of the links that they had available, and this is one of their culturally appropriate resources regarding how to talk to your family about like I believe this is for hypertension. And I've loved, and it's the whole thing is basically like a comic book. It's a whole conversation back and forth through all the family members, their gatherings, and how the conversation comes up. And then it also has some work pages here where you can answer some questions and do a little bit of role playing as well on your own. And I think this is very valuable for the community, and it also takes a lot of stress off of us as to how to figure out how to tell someone, well, yeah, this is how you can talk to your family. They've already put something together to help you do that. And then this is the NILB website. So these are the workbooks that I was talking about that has the so they have actual work pages in them where you're basically teaching a course. So you're walking them through the information. There's quizzes, there's follow-up questions, and then they also have a full booklet for some of these. I believe for this one and this one, they have full booklets of recipes. And this one, the workbook actually contains the recipes in it, and they all have like social media posts and posters and picture cards and different things that you can use to promote these activities. And then here, as you can see at the bottom of this one, this is a different website, but you can still find resources from the CDC on this website. So this is also a part of those finding evidence-based resources. You'll typically see them sourced and cited in more than one place because they're evidence-based and they give good information. And so this is going into where I found those. So this is just a screen recording of when you get to the landing page of the website. Oh, and here I can actually post in the chat. Once this finishes up, I'll go back and I'll post the links in the chat. So so you'll have those. But this has a ton of resources, and this is not even just scratching the surface of what they have available. So that's just one of the resources, and they have, and most of these resources are only about 1 or 2 pages long. So they're very information dense, but they keep it short. So it's really one topic at a time. They're really good to use as handouts. So if you're doing events or tabling events, there's something that you can have as a talking point and information that people can take and literally just put on their fridge as a quick reference. Let's see if it'll let me copy it here. Okay. No, so it doesn't let me copy it, but I will type it. All right. So this is the CDC website. Did anybody have any questions so far? The link I shared in the chat, you can't see that yet, Karen?
Oh.
Oh, okay. Oh, no worries. Okay, good.
My
Yeah, I just wanted to make
apologies.
sure
It was just a
showing up.
little delayed.
Oh, okay. Yeah, it's probably because of my screen share, so the connection is a little bit slower. Yeah, these are definitely some of my go-to resources, especially when dealing with like nutrition and different diseases and just kind of management for those things. So it takes a lot of stress off. So now we'll get into how you can make your own presentations. It can seem very daunting, especially when you start looking at the type and the amount of information that you can put into a presentation. But the key is definitely to narrow your topic down as much as possible. Always keep your audience in mind, and then also you want to make sure that you have assessments for how the presentation went, how you can do better, and then that also helps build your confidence as you're getting more positive feedback and even good criticism that can help you do better moving forward. It makes it a lot easier for you to feel comfortable in different spaces. So this is the roadmap to building that presentation. So you always want to start with your research. So like I said, you want to narrow your topic so that you don't end up with a lot of information or a lot of different points that you have to research. And that will definitely help narrow down what you find and what's available. And then also making sure that you're getting the most accurate and up-to-date information available. One of the good things about dealing with public health is that you want the most current information because science changes. What we know about different things changes. And so because of that, typically once it's no longer useful anymore or it's out of date, then now you no longer need that information. Like it's good as far as seeing where we've come from, but it won't actually oh, okay, I'll double check those links and I'll repost them towards the end. Okay. And so once you get your research together, then you want to form an outline. So how do you want to organize the information? How does it make sense to present it? Also, what all do you want to include? So having that, having the information available and the sources already available makes outlining it super easy. And then once you get the outline going, now you want to decide how you want to present the information, what format will work best. So like with the resources that I shared earlier, they have them in different formats. They have PDFs, they have PowerPoints available, videos, audio. It depends on how you want to present it, who you're presenting it to, and then also why you're presenting it. Sometimes the why will determine the format for you. So once you get the format set up, you want to design it. So basically, like how I did with this presentation, I used Canva. And if it's your first time using Canva or you haven't used it in a while, they do have a free pro membership, which is what I used. Because a lot of these features that I'm using now are like pro. So you either have to pay for them per use or you have to pay for a subscription to access them. But they have a ton of really nice free resources as well. So you can still make a very nice presentation with the free version of Canva as well. So that's why I've loved using it for well over a decade now for several different things that I do. And then presenting it. So how do you want to present your information to your audience? Do you need an interpreter? Will they have handouts to follow along? Will there be an outline? Do you need notes? Do you have any other points or things that you would have to make sure that you point out or emphasize? Because I could definitely send this presentation to any of you, but if you didn't sit in on this session and listen to me talking, how much of this presentation would you be able to understand without me talking? So you also want to understand the role that you play as the presenter for the presentation or the information that you're sharing. And then always assess, whether it's a self-assessment or a group assessment from who you presented the information to. You should always follow up your presentations with assessments. That's how you get better. Like I said, that's how you build confidence. And that's also how you just, you can learn the information better as well. So eventually you'll know it right off the top of your head and you get everything situated properly. So moving forward, you can do either less research because now you have more information on hand from the presentations that you've done previously, or maybe you can format things quicker, you can kind of shift things around. So once you've made one presentation, it's typically very easy to create more based off of that one presentation. So researching, research methods here. I typically keep almost every almost every resource that I look into, especially if I'm seeing that there's more information than what I can use at the moment, but it may be useful in the future. I'll bookmark it and I'll make a note of either why I'm keeping it, or I'll make a bookmark folder of the type of resource it is. So either the category, if it's like heart health, and I'll do heart health. If it's something to do directly with something on my job, I have a separate folder for that. So bookmarking things and making folders is super important because before you know it, you will have a ton of random resources, or you'll remember information, but you won't remember where you found it. But when you're making presentations, you always want to be able to cite your sources, list them, refer back to them, or refer other people to them. And people themselves are resources. So this is also another reason why we'll talk about later why growing your network is important, not only for work things and referrals and things like that, but also when you're vetting information, when you're getting information, when you're trying to find information. Sometimes other people have already found the source that you're looking for and they can just share it for you. And that may save you hours of scouring the internet and journals and things looking for this information. When you outline your presentation, you want to use methods that work best for you. I don't know if you can see my dry erase board back here. But I have a giant dry erase board in my office. I have a giant dry erase board at work because I love using dry erase boards to sort information and outline things and make lists and sort my information that way. Sometimes I use Post-its or note cards, depending on if it's like a book that I'm finding information out of. I'll put the source on there and then the information that I found. If it's a direct quote, I make sure I know it's a direct quote and that I have to cite the actual source that I'm getting it from. Especially if you're planning on publishing any of these presentations, you want to follow those methods because plagiarism is a thing, and sometimes people do sue for you taking and using their information or sharing it without their permission or without citing them and things like that. So just to avoid all that, it's best to cite the source. And plus, people want to ask you like, well, where did you get this from, or how do you know? Because I always encourage people, don't just take my word for it, or don't just, you know, sit here and listen and nod and say, yeah, like go and put your own eyeballs to it, because it's definitely going to make that information stick. When you read the information, you were able to process it yourself and make your own interpretation of it. So I always encourage people to do that. So I hold on to those sources so I can share them. And then if it's a group project, having brainstorm sessions is usually vital to the planning process because you have a lot more heads trying to come together, and then also it improves creativity, and you also get a lot more out of your sessions and the information that you have available amongst the group. And then once you get to formatting it, you want to make the format as relatable as possible. I have ADHD, so I love colors. So that's why my presentation is colorful. But I also understand that I'm not going to be the only person looking at this. So I want to make it readable. I want to make it interesting for others as well. And I also want to make sure that it's clear, that what I'm saying is clear, and that what is important on each slide is clear. And then you want to make sure that the method that you're using is reproducible. So PowerPoint is very easily reproducible. It's a format that can typically be used on any technological device. And if you have to save it on a flash drive, it's easily accessible. I was lucky enough to be able to access my presentation through the Canva website directly. So that's why I'm able to present here, because my networking between my work computer and my personal laptop, there's firewalls, and as a CHW, and we deal with PHI, we have all types of encryptions and things like that, and then the file is huge, so I can't just email it to myself. So you have to keep in mind those type of things, like if I have to access this from a different device, how would I do that? If I have to give it to someone else to present, how would I get this information to them? So having clouds, having it saved on more than one device, being able to access it through the web on more than one device, and then saving it to each of those devices. If you have to do that, make sure you do it as much in advance as possible so you can work out any bugs prior to. And then designing it. So a lot of these little images, like I said, they're a part of the Canva Pro package, but they have other ones that look a little bit more simple and would have done the same job. But like I said, I love color. Oh, who's muted? I'm muted. Oh, okay. I was looking at the chat. Okay. And so using things that are going to be readable, but also fit the style of the presentation. So if you're doing, let's say if you're doing a presentation about working out or staying active, you'll want to use bright colors, things that promote activity, things that are going to be bold and stand out. And you may or may not have, a lot of words. It might be more videos or pictures or things like that. So you want to make sure that the design fits the content as well. And then you'll want to consider your audience. So if you're presenting to children, which I typically do probably more often than not, you want to make sure that it's going to keep their attention. If you're presenting to older adults, you want to make sure that it's going to be visually receptive for them, because I wear glasses, so I know if the font is too small, it's going to be hard to see. People, they'll get tired from trying to squint their eyes to see the words. So if you have to, like, this might be broken up into 2 or 3 different slides, and then this would actually become one sentence, and then another sentence would go in a different box, so I can make the font larger. So just considering your audience is always important when designing your presentations. And then also you can use the same presentation and then just edit it for different audiences as well. And then when you're presenting, so you want to keep your audience in mind at all times. So some information may be true, but it might not be appropriate for the audience that you're talking to. Like I said, I present to children a lot, so I typically wouldn't talk to things that either children wouldn't know about or wouldn't matter to them. Like I even had to reel in a citizen who was requesting my presence at a community event that they were hosting, and they wanted me to present basically homicide data for youth. And I was looking at the data that we have on hand at our department, and it didn't say that children were perpetrators of this violence, and honestly, they weren't a large enough percentage of the victims of the violence for it to be a topic that I would cover at length. So I told her that it didn't seem like it would be an appropriate topic for children under the age of 18, given the way the statistics run. So you want to also, exert your authority in those spaces as well, because you are the expert. If you're being asked to present, you are the expert on this topic of this thing that you're talking about. So always be confident in the information that you're presenting, and then also always be confident in how you're setting up that information or that presentation. Like how I did. I told her, I was like, well, it would be better to do childhood immunization, not only because that's my focus, but because children need to know why they're getting stuck with needles, because it hurts them, but it's also, conducive to their health. And the more that they understand that, and the more that they can help their immune system, the better off they'll be. And so I had to promote that and to advocate for that type of presentation, even though the citizen was requesting something else that I knew was inappropriate for the audience that they were expecting me to present to. And then finally, assessing. So you want to ask what went well and what can be improved. Like I said, whether you're asking this of the people you presented to or yourself. Also, even if you don't do an overt assessment, like have people fill out a questionnaire or something like that, you can get those answers in a Q&A session as well. Sometimes just even if you don't ask, like, well, what do you think about the presentation? Sometimes the questions that people have about the presentation will show you where you can improve those things, because if you feel like you've already answered those questions in the presentation, then maybe you want to go back and make sure that it was clearer, or that the information was more robust, that it actually covered the topic of the question that was asked. And then practice. If you practice by yourself in front of a mirror, or to your cats or your children or friends, coworkers, anybody who will sit and listen and can give you feedback, is going to boost your confidence, is going to increase your ability and your skill, and it's fun. At least for me, it's fun. So and I talk to myself a lot anyway. So so it's actually not out of the ordinary for me to do these things. And so here with when you're getting information, you always want to stay informed. So now we'll get into the newsletters and why the newsletters are important. So you want to look at what type of organization do you work for. So I work for public health. So I actually was automatically enrolled in the NACHO newsletter because of the nature of my job, and the public health department has a standing membership with them for its members, for its workers. So because of that, I get public health newsletters that talk about different endemics and upcoming disease watches, public health initiatives that are national, and we have forums and things through this newsletter. So there's lots of information and access that can be had by joining a newsletter, especially if it's specific to the topic of the organization that you work for. Like if you work for, here we have Moms First, so they work with pregnant women to address infant and maternal mortality. So if you work in that field, you'll want to join different newsletters that talk about infant and maternal mortality, infant and maternal health, and different things like that. And then you'll want to make sure that you know the information that you're responsible for knowing. So if you are serving your community in the capacity of whatever the type of organization you work for, then you absolutely want to know the information that the organization is basically known for. And then if you want to make yourself that much more valuable, know the little intricate details outside of that information that is generally available on the website. Researching, finding those evidence-based resources, and also being subscribed to newsletters. It'll keep you current. You tend to get access to information that isn't publicly available right away. And or if it is publicly available, unless people are searching for it, they won't know it. And then who has the information you need? So finding the organizations that are providing those newsletters, you'll want to find them and subscribe. So I do have some examples. So here, this is the Association of Public Health, and they have a list of newsletters that you can sign up for. So they actually have the topics of the newsletters available. And typically that's how it looks. So if you have more than, if they offer more than one type of newsletter to sign up for, it'll ask you specifically which ones you want to be signed up for. So you don't just get everything that they ever offer to your email, and now you can't, find your working email. And then if you also the technology piece, you can sort your email so that when they're sending these newsletters, they go directly to an inbox folder, not to your general inbox. So that way is another way you can sort your emails and be able to find them easily. So why sign up for newsletters? They're brief. They take a ton of information and they usually condense it into maybe 1 or 2 pages worth of reading. They're focused. They're always about a specific topic. They're not general unless they say it's a general newsletter, and then it'll have a bunch of different topics, and then there's only usually one paragraph available for each topic, and then you can delve deeper. They're current. So like I said, they typically have up-to-date current information. Even a history newsletter would still have current, like new findings based on, the Titanic sunk X number of years ago, but we just finally got the technology to dive all the way down there and we found this. So you will always find current information in newsletters. I love them. Now, finding your evidence-based resources. So any type of health information, it can be very full of jargon, hard to read, not very interesting to read through. Typically, I just read the abstract, which is basically the summary of what was the study about, kind of what did they find out, and then I'll read the conclusion. And then if any of those had information in it that interested me, then I'll go back and I'll read the full article. Otherwise, I typically don't spend a lot of time reading through the entire journal article or publication. So in this one, going through our evidence-based resources, we're going to talk about how to vet resources, signs of credibility, and then also how to improve your health literacy. So we all know Shakespeare. Is the author credible? Shakespeare is a very well-known author, but he does not write anything of fact. So he would not be a credible author if you were to use him as a source, unless you're talking about his specific work or the things that his work dealt with. But if you're talking about heart disease and how to prevent it, Shakespeare wouldn't be the author you want to use, even though he does talk about does thy heart follow the, that type of stuff. No. And then are there other sources? So as I showed you on the other slide when we were looking at the NILB sources, NILB also cited CDC. So there you'll see overlap of sources using each other sometimes, and the more you see that, the more you can kind of follow those around, and they'll kind of show you that yes, this is good evidence. We've expanded on their research and we found this as well. Not only did we verify what they found, but we also found this. So depending on how deep you dive and how much you read into these kind of technical journals, you'll see that a lot where the sourcing is shared. And does it make sense? Sometimes it's hard to tell, especially depending on how much jargon is used and how dense the reading is. But if it's something that's kind of consumer based, which is why I love using Healthline. Healthline is a great science and health and medical resource for consumers, because they talk about it like it's an article or magazine, but they use primary sources. So they're using the CDC reports, they're using the science and medical journal articles that are directly published by directly published by these hospitals and science journals. So being able to make sense of it yourself is usually a good indicator of if it's going to be a useful source as well. Signs of credibility. So websites. We're in a very technical world, and libraries are accessed probably less than they were before, and less than they should be now. But .gov, .org, and .edu is a very great way to see from a distance if it's a credible website. Typically, journals are peer-reviewed, meaning that more than one person has looked at the information that is an expert in that field, and they said that this makes sense and it has been verified and is good information. As I stated before, it cites other reliable sources. So if you already know that the source is reliable, then it's cited in this source, then it's very possible that the current source that you're looking at is also reliable. Now, increasing your health literacy. Medical terminology is the bane of our existence, but you can get dictionaries, they have courses and all types of things. And then once you take those terms, so let's say you're sitting in the office with your client and the doctor is talking, you want to make sure you understand what the doctor is saying and then make it plain and tell your client, but you also still want to slowly start filtering in those terms with your client so that they can get up to speed, because our whole thing is to empower our clients so that they no longer need us. So we want them to still get used to using the proper terms, but also be able to kind of interpret it themselves. These are great technology resources. So cyberseniors.org is a free source for pretty much anybody, but it's directed towards seniors. My community college here at Tri-C, I know for a fact they have technology courses that are free for seniors, and I believe it's pretty cheap if you're not, because they just offer free classes for seniors anyway. But it's a pretty cheap one-off class as well that gets you basic literacy. And then LinkedIn as well, they have learning modules on different topics in that realm as well. And then growing your network. So always networking. Everybody I talk to, I get their contact information. I share mine. I ask them what they do. I try and figure out how we could collab on something. And a lot of people do reach back out to me when they're planning events. They're trying to get someone to come out. You want to maintain those references. So even if you aren't working with them or doing events, just reach out, see how they're doing, see how something that they had going on is working for them. And then last but not least, but I found was super important, is business insurance. We as certified community health workers, we are technically a contract worker, so we can work as our own business entity. And because of that, you can get business insurance that will actually cover any liability for presenting health information, health topics, and things like that. Thankfully, I have never heard of us getting sued, but if something like an entity or something that we worked for gets sued, our business insurance will actually cover us and any legal costs or anything that we might ensue by being associated with that organization. So I have it, and it was required for a contract job that I'm doing with the community college here. So that's how I found out about having it and the importance of it as well. And then it also eases any apprehension that you would have about sharing information that you're not comfortable with or you're not confident with, but it can definitely ease some of that. And we are complete now. So thank you for your time, and definitely working to get our voices heard and our leadership respected. Stop the share. All right, there we go. Thank you. Thank you. Thank you. Oh, and here I actually have a link for, this is for a survey, the assessment. So remember that part that I mentioned earlier. So the assessment, so that I can make sure that I'm improving along with you all. And because of you all. So that's the link to the survey. So it's super short, and it has a few 1 to 5s, and then there are some long answers. So if you wanted to put something specifically in there, felt like he was back in college. I'm actually currently earning my associates in anthropology. So a lot of what I shared was stuff that I learned recently in my my English class. And I was like, this is like super important information, especially when you're sharing other people's information. Thank you all. Thank you for stopping in. This was very surreal for me. A master's in healthcare. Nice. I'm planning on getting a master's in public health whenever they get some funding for the Case Western spot here. So they're doing a Northeast Ohio training for Northeast Ohio workers. So because I work for the city of Cleveland, I qualify for that grant. So hopefully they get some funding for it soon. Yes, so they gave us a link where we can send materials that can be posted to the website. So I'll send my presentation on over along with the links, the separate links for those websites, and then possibly like just some notes. Oh, I have lotion on my hand. I'm like, why is my eye burning? Yes, absolutely. We're a small group out here, so we'll probably end up running into each other just doing our community health worker thing. And plus, I plan on going to the in-person meeting next year in October. I believe it's October, but yeah, next year. So yeah. Okay. All right. It was a pleasure presenting to you all. Thank you all for coming. They're getting ready to close us out.